Spring Intensive, where we're talking about all things relating to inspiring conscious healing and our next generation of conscious healers. I would really love to thank you again for coming out today and taking the time to listen to more about the issues surrounding nursing school and cannabis and how we can better provide support and education to our next generation of nurses. Here today to talk more about nursing school and cannabis, more specifically, how we can do better when it comes to inspiring and teaching our next generation of conscious healers. For a little bit more background about me, for those of you I haven't been lucky enough to meet, I have been able to serve as a fierce patient advocate and educator for over 2 decades in multiple states, including New Mexico, Texas, and California, while strongly advocating for one's right of choice to use natural healing plant medicines. My backgrounds are comprised of behavioral and community health, substance abuse care, and nursing education. I have strived to improve the standards of care for medical cannabis patients in and out of different realms, from the Capitol Roundhouse up in Santa Fe or the patient bedside in various clinical settings. I also helped found and run the largest medical cannabis patient advocacy group in our state, the New Mexico Patients Collective. As an educator and instructor currently teaching through Central New Mexico College, I am passionate about opening minds and inspiring the next generation of healers, one conversation, one lecture, one skill checkoff at a time. I will be known as the nursing instructor that didn't give up on you, no matter how many times you came and cried in my office. So why does it all matter when we're talking about providing up-to-date cannabis education to our student nurses and why it's important? So would it surprise you to know that in the year 2023, we still have nursing students coming out of nursing schools being taught nothing about plant-based medicines, cannabis therapeutics, or the endocannabinoid system? Sadly, it is very much a reality of the times, not just impacting 1 or 2 nursing schools, but several throughout the country nationwide. As nursing educators and instructors, we have the opportunity to provide our nursing students more up-to-date and relevant peer-reviewed studies and evidence surrounding cannabis than we ever have before. And disappointingly to say, there's still a problem today in nursing schools around the country when it comes to the standard of nursing education being provided to them surrounding cannabis. The truth is, there is no educational standard when it comes to cannabis education in nursing schools across the country. It's also not the same state to state, school to school, program to program. When it comes to inspiring our next generation of conscious healers, we have to provide more honest and real education to our nursing students to be fully prepared to take care of patients in a world where we have more and more people commonly using plant-based applications for ailments, remedies, and condition management. This matters for primary reasons surrounding the education taught and received surrounding cannabis in nursing schools by affecting issues in education related to safety and patient care, patient advocacy and education, harm, stigma, and bias reduction, and of course, reinforcing holistic nursing care provided from conscious and informed healers. Let's better explore together how we can do better by our nursing students when it comes to providing more honest cannabis education while preparing them to be the future nurses of tomorrow. To find out the current causes of the state of nursing education surrounding cannabis right now in our country, and to find out how we can really start doing better by our nursing students, we have to first acknowledge the causes that can block us from providing honest and current cannabis education to them. Some of the potential root causes for the status quo surrounding cannabis education and nursing school curriculums can relate to outdated stigmas and mentalities endorsed from deans and leadership, which can include a lack of inclusion in overall in the curricula related to those outdated stigmas and mentalities surrounding cannabis that can be endorsed from deans and higher-ups of the nursing programs themselves. This can have far-reaching consequences for nursing education and patient care. It's important for nursing leadership to stay up to date on the latest research, trends, to be able to provide evidence-based education to nursing students on cannabis and its therapeutic uses. A lack of formal education on cannabis and its medicinal uses in nursing schools can also be a reason, and that can simply relate back to inadequate instructor training, experience, and lack of curriculum development in areas specifically related to cannabis or the endocannabinoid system, And that can lead to students not being taught about it at all in nursing schools right now. There are also legal and regulatory constraints that act as barriers to nursing schools that they can face in providing better education on cannabis. Because if there is a perception of legal risk that is associated with teaching about medical cannabis, it could lead to a lack of better and more formal and standardized education surrounding the topic. Nursing schools may be hesitant to offer education on a topic that is still legal at the federal level, while also being concerned about the liability if they can provide enough information that is accurate, while also not providing any incomplete or inaccurate information. The current state of nursing education surrounding cannabis across the country is highly unequal to downright non-existence in nursing programs due to these gaps of educational standards and nursing programs. It can create and foster unsafe standards of care surrounding medical cannabis patients, especially if a nurse or student nurse doesn't know anything about medical cannabis, but they're taking care of a medical cannabis patient. Wouldn't you agree? So, as we're talking about the current state of nursing education as it relates to cannabis, I know you might be asking yourself about now, well, didn't the NCSBN or the National Council of State Boards of Nursing release minimum standards surrounding education in cannabis for nursing students back in 2019? It was actually back in 2018. They released a basic set of 6 standards of nursing education surrounding cannabis that should be provided to nurses through nursing school. And it was set out a whole year earlier to try and get things moving in the right direction. Unfortunately, the COVID-19 pandemic hit, and cannabis-based focused education for nurses kind of took a derailment to infection control and reinforcing PPE usage. So it's one of those things where we just need to get back on track, I believe, and go back to those standards that have already been set. And even relating back to that, for a fun fact right now, did you know that out of our larger providers of current nursing-based education from ATI, Kaplan, Excelsior, Lippincott, and Wolters Kluwer, there is currently no standard of education accepted on cannabis education when it comes to a nursing context between all of them. So that means that there's this unstandard in the nursing education that is being provided to students based solely off the providers of whatever chosen curriculum content creator or publisher is being used by a nursing school. So that means, simply put, that the nursing education that a nursing student is receiving surrounding cannabis can be greatly influenced from the publisher or the state they simply reside in. So I'm sure you're also wondering by now, how are we doing? If we've set these standards since back in 2018, shouldn't nursing students be learning at least a little bit more about cannabis? Actually, one recent study sadly found from fellow cannabis educators and researchers that few nursing students are actually receiving the education from their nursing programs based on the NCSBN's 6 essential principles of knowledge in the care of patients using cannabis. That was regardless of their location, what state they were in, or the type of nursing program enrolled in. That could be BSN, MSN direct entry, RN to BSN, and quite frankly, that statement has so much further reaching implications, because when you think about it, you would want to believe that nurses in California, Colorado, New Mexico, states where cannabis has generally been online longer medically, they've had thriving adult use programs, we would want to believe that the nursing students in those states are at least receiving a more complete or more realistic education surrounding medical cannabis. But it's sad to say that it's still not happening even in some of those states. So this disconnect that we're seeing across the country of the education that our nursing students are receiving, we really need to do better as nursing educators and instructors to help fill those gaps for them and improve the current standard and state of the nursing education being provided to them surrounding cannabis. The importance of educating student nurses on cannabis is paramount when we're coming to talking about how we can do better for our nursing students and the education we are providing them about all things cannabis related. Nurses have a role in providing patient education when it comes to answering questions about medicines and advocating for a patient's right of choices in their treatment. Studies have shown that informed and educated nurses and nursing students can better help patients use cannabis safely and more effectively when they are more educated on the topic. There are also potential benefits related to the inclusion of quality, honest, and evidence-based education that could come from cannabis being more involved and present in nursing curriculum, including improved patient care outcomes and increased knowledge of alternative therapies and holistic applications of plant medicine while providing more comfortable care to the patients who use it. It also facilitates the learning of evidence-based practices, including education on cannabis and nursing curriculums can promote evidence-based practice as nursing students will learn about the latest research on therapeutic uses of cannabis. This can help reduce the use of outdated stigmas and mentalities surrounding cannabis that may not be based on scientific evidence currently available. It also better prepares student nurses for changes in healthcare practices, even as we're seeing today as cannabis is becoming more increasingly accepted as a therapeutic agent in healthcare, with many states legalizing medical cannabis, even adult use cannabis now. By including education on cannabis in nursing curriculums, nursing students can be better prepared to care for patients who use cannabis as part of their treatment plan. The inclusion of education on cannabis in nursing curriculums can have several important and potential benefits for nursing students and their future patients, including improved patient care, increased knowledge of alternative therapies, promotion of evidence-based practice, and the preparation for changes in healthcare practices. I'm hoping by this point I've got you more pumped up and eager and ready to find out, okay, what can I do to go back and help my nursing students? How can I provide them a more realistic education that will better prepare them for the care situations they may be facing tomorrow surrounding cannabis? So some strategies that we can actually do as nursing educators, instructors, and professors to do better by our nursing students when it comes to cannabis education, we can incorporate cannabis education into the nursing curricula, which would just basically be nursing schools incorporating information on cannabis into current curricula that ensures that students are educated on the topic and the following 6 core principles set out by the NCSBN. This could include courses or modules in cannabis and pharmacology, behavioral and community health, or more about the endocannabinoid system through anatomy and physiology, while learning about the potential therapeutic uses of cannabis as appropriate to a student nurse's learning journey. Nursing schools can also provide more hands-on training, and that's typical to student nurse learning right now. And that could be through either the administration or observation of cannabis products, such as through tinctures, oils, and edibles. This can include simulated virtual learning scenarios or clinical situations where students can also observe and participate in the administration of cannabis products or in the care of terminally ill patients who are using cannabis products in medical facilities and situations. We can also hire more nursing instructors and educators with further cannabis training and education to serve as cannabis nursing specialty experts on staff. And that's just another way for nursing schools to include cannabis experts in the faculty. These experts can then provide valuable insights into the latest research on cannabis, as well as share their expertise on the therapeutic uses and potential risk associated with cannabis use. This will help ensure that nursing students receive accurate and up-to-date information on cannabis. We could also be encouraging nursing students to have further dialogue while learning and researching about medical cannabis. Nursing schools and instructors can encourage research on cannabis by providing more opportunities for learning, potential funding, or resources to the faculty and students who are interested in studying this topic further. This can help expand the knowledge base on cannabis and its therapeutic uses and inform nursing practice in this area for newer nurses. By incorporating these strategies into nursing education, we can improve that quality of education that is provided surrounding all things cannabis to help prepare our future nurses to provide more safe, effective, and compassionate care to those patients who use cannabis while being more actively conscious and informed healers. In conclusion, cannabis isn't going away anytime soon. A recent study found that nurses and nursing students are increasingly encountering patients who use cannabis for medicinal purposes at a rate more than ever before. By incorporating the previous strategies we had just gone over and how we can do better in nursing education when it comes to providing honest and up-to-date cannabis education to our student nurses, and how we can inspire them to become the next generation of conscious healers who are better equipped with the knowledge and skills to provide informed and compassionate care to patients, including those who use cannabis. Are you ready? This is a serious question now. Are you ready to disrupt older stigmas of nursing education through research and available current studies in a movement that was pioneered by Lovey Ajay Jones and her motivation and sentiment of simply taking action to do better and being positive disruptors for better change? Are you ready to take action to do better for the future of our nursing students? As we know, nursing schools can no longer afford to wait idly by, wasting learning opportunities and time to enhance and make our next generation of nurses safer and more efficient when it comes to providing quality care to those who use cannabis for medical purposes. Are you ready to help train and prepare the next generation of conscious healers with me? Thank you all for taking the time yet again to come and listen to me share my experiences surrounding nurse education in cannabis and how we can take some positive actions to do better for future nursing students and next generation of conscious healers. I truly believe that we cannot prepare our future nurses to care for the patients of tomorrow with outdated information and beliefs from yesterday.